Hi guys, thanks so much for all your comments about the previous video and all the questions, and I will definitely get to them in one form or another. But today I'm going to focus on this one particular question that came my way, not because it's the most commonly asked, but because it's just a fun one, and we can certainly use some fun right now. So this person reached out because they noticed something unusual in their mouth, and they were concerned that it might be oral cancer. And so without being able to see a dentist, they reached out to me with a photograph. And there's not a lot of things that you can diagnose over just by seeing a photograph. A lot of the times you need a proper exam and sometimes even a biopsy. But there are a few things that are pretty obvious and you can determine with a certain degree of certainty as to what it is. And so it was one of those cases. And it reminded me of a fun story that happened many years ago, and I'm going to share that with you. A young female patient scheduled an appointment with me after not seeing a dentist for quite some time. And the reason she did that is because she too found something in the mouth that she was really concerned about, and she finally made it into my office, but not before she did what everyone with an internet connection does. She Googled it, and Google did what Google does. It gave her all possible diagnosis of what it could be, anywhere from totally normal, will go away in 2 weeks, to death is imminent. And so, not being satisfied with those two options, she finally made an appointment and came in armed with medical terminology and says, "Doc, I'm really concerned. There's petechia on my soft palate." And so, word of the day, petechia. Petechia is just breaking of the small blood vessels, such as capillaries. When they're clustered together, we generally refer to it as a bruise. And so I completed my examination, and I did notice she did in fact have a bruise on her soft palate that was round in shape and about 1 inch in diameter. And realizing how sensitive this issue may be, I figured I'm going to ask her this follow-up question, and she'll understand exactly what I'm getting at, and we won't have to continue a conversation that may potentially make her feel uncomfortable or embarrassed. And so I had asked her if she had oral sex recently. But that question completely backfired. She got even more anxious. Her eyes got really big, and she says, "Yes, oh my God, is it an STD?" So I say, "No, it is not an STD. It just means that you may have enjoyed oral sex a little too much and you bruised your soft palate." And we had a few laughs, and I never saw her again. Pretty sure that embarrassed her a little too much. So I'm going to leave you with this. Oral cancer comprises about 85% of oral head and neck cancers. Main causes are tobacco use, sun exposure, and HPV, which is an STD, and it can cause cancer. Some of the strands can. So what you need to do, you need to be familiar with your mouth, but better yet, see your dentist. Google is great. Everybody uses Google, including the doctors. We use it to look up articles and use it as a reference and confirmation. And you can ask Google anything without feeling embarrassed. The problem with Google is that it can't ask you anything in return. It can't ask you about medical history or dental history or social history or family history. And it cannot ask you if you had oral sex yesterday, in order to take all possible diagnoses and narrow them down to a more probable ones. And so don't let Google replace a licensed healthcare professional. See your dentist regularly. I do oral cancer exam on every patient at every checkup visit, and we take photographs to establish a baseline. So if you do notice something in your mouth, don't panic. General rule of thumb is give it 2 weeks. Most things will go away in 2 weeks. If it didn't go away, it's also possible that it's always been there, you just noticed it because I made you look. So again, don't panic. But if it is something out of the ordinary and it doesn't go away in 2 weeks, the next chance you get, please see your friendly dentist so they can do an oral cancer screening on you and check things out. So practice safe sex. Don't practice it too close to your dentist appointment. We will now. Till next week. Bye.